Hi guys, and we're back with the second video of my introduction to nursing. So what do nurses do? Nurses do a whole bunch of stuff, but first I think we should get into what nurses wear. Nurses wear scrubs. They're basically like pajamas. They're super comfy. You usually use a stethoscope, that's around your neck, a badge, that's pretty much it, you're good to go. Same thing, scrub pants, sneakers, that's your uniform. Super easy to get ready in the morning, doesn't take a lot of effort. This is like what I'd be wearing to work on a normal day. And typically my day would start at like 6:30 p.m. That's about what time you want to get there, a half hour early. Pretty much when you get there, you will get report from the nurses who are taking care of the patients that you will be taking care of. So you basically go over what's wrong with them, if they had any problems throughout the day, what they're going to need coming up. And then after report, basically you go through the charts, look at lab values, see if their blood work came back with anything wrong with them. And then you start passing your medications. Medications are extremely important. That's mainly what is going to help the patient get better. So you have to make sure that the right patient is getting the right medication and the right dose. They're getting it at the right time. They're getting it the right route, meaning if it's an oral med, they want to get it by mouth rather than through their IV. And then after you give medications, you will start doing your assessments on your patients. That could include vital signs such as blood pressure, heart rate, respiratory rate, temperature, pain. You will listen to their heart, their lungs, their bellies to make sure their bowels are working okay. You'll do range of motion on any parts that are weak. So you'll help them move. You might take them on a walk along the floor. You'll empty their catheter bags if they can't go to the bathroom on their own. You'll check their IV site, check their skin, make sure their IV is running at the right rate. You also do a lot of patient education, so you'll teach them about their disease, teach them about the medication that they're getting, or if they're getting discharged, teach them what they need to know to go home. How are they going to take care of themselves at home so they don't have to come to the hospital again? Like I said, you do a lot of assessments on your patients like we went over. Nurses put in IVs, doctors don't. So if you need to get fluids or medication, we're the one that's doing that. We do other procedures, such as catheterization if they can't go to the bathroom on their own. We'll put in a nasogastric tube, which goes through the nose to the stomach if they need to be suctioned or if they need to get like a tube feed that way. We cleaned wounds. So if you come in and have like a big open wound or like brush burn, we clean that out and wrap it up. We do all that stuff. We take care of chest tubes. So if you get a collapsed lung, for example, the doctors put in the chest tube, but we're responsible for checking how much is coming out of it, making sure it's still in place, kind of all of that good stuff. We also take care of tracheas. So if the person can't breathe on their own and they need a trach put in, we're responsible for cleaning them, changing it out. So nurses do a lot of stuff other than just medications as well. We do a lot of hands-on skills. Like I said, lots and lots of charting. Anything you do, it has to be put into the patient's medical record. We chart all of our assessments. We make sure that all the medications we gave are in the system. We write notes so that other nurses or the doctors can quickly read what's going on and stay up to date. Patient care, that's just basic needs. If they need help being fed, we do that. We order their food for them. We give them baths if they need help. Change their sheets, get them out of bed and into the chair. just talking to them and hanging out with them if they don't have any family there with them. Patient rounding, we do that every hour just to make sure they have everything they need, their call bell, if they have to go to the bathroom, to make sure they didn't fall out of bed, which would be really, really bad. And then also patient rounding in the sense of meeting with the doctors and other nurses, discussing who's a fall risk, who will be being discharged, if anyone's being admitted to the floor, all of that stuff. Nurses work with all professions in the hospital. We work with the doctors, the PAs, physical therapy, occupational therapy, case management, nursing assistants, patient care assistants, the patients, the family. So we really interact with everyone on the floor. And then if something were to go wrong, we run code blue. So if someone's heart stops, we're the one that's doing CPR. We're the one that's giving all the medications. The doctor's pretty much there to kind of tell us what to do, but the nurses are the ones who do it. And then if you kind of don't like what you're doing, so if I'm working in the emergency room, something that's really great about nursing is you can switch specialties pretty easily. I'm working in the ED and a job opens up in the pediatric ICU. I would have to apply for it to get transferred. I would go through another orientation period and I could start working there. A year or two down the line, I don't like the PICU anymore. I want to go to labor and delivery, kind of the same thing. So nursing, there's a lot of flexibility of where you can work. If you don't want to work in the hospital anymore, you can get a job as a school nurse, in the jail. Pretty much your experience you'll keep with you for life, and you can move around as you please. But if you want to change it up, you can go back to school to get a master's degree or doctorate degree in something. You can become a nurse practitioner. They're kind of like a physician assistant. Nurse practitioners can work independently. They're able to write prescriptions. They see people in the offices, give diagnoses. A nurse educator, they teach nursing school. So they're the people that are giving new nurses their education. A certified registered nurse anesthetist, or CRNA, that is probably the hardest nursing profession, I would say. It takes 3 more years of school. It's extremely difficult to get into. You're studying for 8 hours a day, but they put patients to sleep when they're getting surgery. A lot of responsibility, but they definitely get paid very, very well. A nurse manager, they're in charge of their unit, or all of the nurses that work in the hospital. A clinical nurse specialist, they specialize in one area, so you can have an emergency room specialist, a medication specialist, and then a nursing director is in charge of the whole floor. Up next, I just have a couple videos to give you an idea of what nursing is about. So this is just a quick overview. It was Nurses Week just a couple weeks ago, so this video will just kind of show you what nurses do in the hospital. It doesn't get too specific. I'm just going to fast forward a little bit here because it's just her like at home, and this is what happens when you get to the hospital.
Leading, learning, innovating, collaborating, and advocating. Bringing passion, skill, patience, and focus every day to people who need it most. Selflessly caring for patients and their families when every second matters.
We're going to put you on our heart monitor, okay? He's got an EKG, a chest x-ray, and 12.5 milligrams of heparin.
How did you sleep last night? Did you do good? Okay, did you feel good? You're looking so much better. Yeah. The patient in room 2 is doing great. She's stable. Hi. How are you, Jenny? I'm here to change your IV, alright? I'm bringing you some meds and some spray, and I want you to drink it all, okay? I need you to keep hydrated, okay? Nicola's doing really well.
She is. We're very happy with her progress.
been said, save one life, you're a hero. Save 100 lives, you're a nurse. To all of those who dedicate their lives.
And then I have one more video for you guys. This is actually going to go into detail what a typical day looks like.
Hey everyone, it's Sarah with Registered Nurse working in a hospital.
So yeah, here we
now
go.
keep in mind, if you're going to work in a certain specialty like an OR, an I search for a progressive care floor or a telemetry floor. So I want to go over hour by hour what you may experience throughout your day. So let's get started. Most nursing shifts start at 7 o'clock in the morning and they end at 7 o'clock at night, 12-hour shift. So we're going to start at 7 o'clock. At 7 o'clock when you come in, you are going to be getting a report from the night shift nurse. And after you get report, you're going to look through your patient's labs, you're going to look through your patient's medical history, and you're going to start formulating, and doctor's orders, and you're going to start formulating, okay, how's my day going to go? What do I need to start preparing for to get this patient ready for whatever we're supposed to accomplish today? For instance, say your patient's going to be, you need to look and see, hey, is this patient going to go home today? Maybe I need to call the doctor because there's some critical AM labs, because during this time your morning labs are printing off, so you're looking for any abnormal critical labs you may need to call the physician with. So that's typically what's happening around the 7 o'clock hour. Now, from 8 in the morning to 10, you are very busy. This is where you are going into all your patients' room. It depends on how many patients you have. Each hospital has different patient loads. Where I worked progressive care, and we would have no more than 4 patients. But I know nurses who work on med-surg floors, they can have anywhere from 7 to 10 patients. So this is a very busy time, because during this time you're going to be doing your morning assessments, meeting your patient, seeing the status of your patient. You're going to be setting these patients up for breakfast. If you have diabetics, you're going to be giving insulin before breakfast. You're going to be charting your morning assessments, your vital signs, everything that's going on with them, getting your care plans, updating your care plans. You're going to be giving medications. During this time from 8 to 10, usually 10 o'clock, is a big medication time whenever you start giving medications, your AM meds. Calling doctors for any orders, because a lot of times you're going into your patient's rooms and they're like, hey, I need some more pain medicine. I don't feel good. Or you have critical labs, you need to call the doctor, so you'll be really calling the doctors. And during this time is when a lot of physicians are rounding and seeing their patients. So you'll be getting new orders coming in. And you'll have to be following out these orders, like drawing blood or getting a patient ready for a procedure or other things like that, or calling consults. Next, during this time, you're going to be assisting your patient with ADLs, which is activities of daily living. We have nursing assistants on the floor, but only those nursing assistants can do so much because they have a lot of patients. I remember on my floor, we would have 2 CNAs, but we had 20 patients on our floor, and each would have 10. That's a lot of patients. So they can't get to all those patients. So as the nurse, you have to help them. So you're going to help your patient with brushing their teeth. Maybe they want to shower. You need to do linen changes. You have a lot to do during this whole hour, and you're trying to get all that in, because next time's coming up is 11 to 1 o'clock. And this is our next time. From 11 to 1 o'clock, it's another busy time. But it's busy in a different way. During this time, lunchtime's fixing to start. So you'll need to be getting your blood glucoses, giving insulin to your diabetics before they eat lunch.
So basically, she just goes on to say what happens throughout the day. As you can see, nurses are very, very busy. I'm running out of time on the video, so that's why I cut it short. But if you have any questions, I'll be happy to answer them, since we'll be on a Zoom call after you finish watching my videos. We can talk about what happens in the other hours if you guys want to. Basically, it's just a lot more assessments. What you do in the morning, pretty much you repeat at night before you go home. So I hope you learned a little bit about what nurses do and you enjoyed it. I'm looking forward to seeing you guys, even if it is just over the camera. And again, if you have any questions, I will be answering them now.